Hey guys, so today we're going to be talking about how to prevent inferior alveolar nerve damage, especially when you're doing an extraction. So I just wanted to get you guys prepared for that because right now I know that this is something that a lot of individuals end up trying to figure out, like, okay, how can I prevent the nerve damage? But then again, it's just like, where is the inferior alveolar nerve? So what we're going to do is this, we're going to go over a couple of cases so that you guys could be prepared. And so the first thing that we're going to do is this, we're going to talk about where is the inferior alveolar nerve? Because if you can't find it and something happens, then it's just like, okay, how do I move forward, right? Then we're going to talk about some of the different instruments that I use, some of the different tools that I use. We're going to talk about techniques, post-op, and also when to refer. If you don't have those things in your repertoire as you're working with your patients and you're wanting to do these types of cases or take it to that next level, you may have some significant challenges. Now, for all those individuals that are watching, I've completed about 10,000 cases. I work with 30 different offices here in Houston. I'm a clinical assistant professor at the dental school here in Houston. And I like my career. I like what I do. But I definitely want you to be aware of that. I didn't always start at that juncture. It's easy to show, how many cases I've been doing and all these different things. But just like, I want to share some of those challenges with you. I remember, like I said, I had patients that come in to the office after I treated them, have a big old golf ball, breaking off teeth, getting a tooth placed in the pterygopalatine space. Like it could be challenging, but I want to give y'all insight that you can do this as long as you're following the principles that we're talking about. So as individuals are coming on, we're going to be talking about how to prevent inferior alveolar nerve damage when you're doing extraction. All right. So first things first is this. We got to figure out where the actual nerve is, right? And so what I'm going to do is this. I'm going to share my screen with you so you can see exactly where's the case. Let me find a better case. Let me see something. All right. So if you look here, you can tell that this is an inferior alveolar nerve that's sitting right here, right? And so a common question I get is, hey, doc, are we close to the nerve? Well, in this particular situation, we are close to the nerve, but one thing that you have to take in consideration is, like, when you're treating a patient like this is, in my hands, no, you're really not. But the thing is, this is like, if you're going to be taking out this tooth, you want to make sure that you don't apply too much apical pressure, right? So I just wanted to give you that insight there, right? So that's one. We could look on this side. We're close, but not too much. I wouldn't be of concern if I were to be taking out a tooth like this, right? Here's another one. Somebody asked, hey, are we close to the inferior alveolar nerve? So I would say we are in this particular situation simply because of where this nerve is. So if you look at this root, there is a conical root structure that's present, but because it's conical, I don't know if that root is coming towards the facial, towards the buccal, or there's a curve, or there's potential other roots that are going to cause some other challenges. So that's something I definitely want to take into consideration. Here's another one. Here's another inferior alveolar nerve that's present, and you see the roots that are conical. In this particular situation, I would say not close, right? So that's another one. This one right here, this looks like there's a potential that you could potentially have some issues with it, but I would say probably not. But one that I would say definitely that you would have some issues with is going to be something like this. Now, this is going to be super, super duper challenging in a case because, and I don't expect most of you guys to take a stab at these types of cases just where it is, but I wanted to show you something easy, and then I also wanted to show you something pretty straightforward. All right, so as you can see right here, you see this inferior alveolar nerve? Now, this is a case that I would do. I wouldn't have any issues with it. I would just get a CT scan and basically read it. But sorry about the background noise. But in a situation like this, so if you're going to be taking care of a tooth like this is a case that you'd want to have. Also, some of these other cases like this one, it's going to be applicable to this one. It's also going to be applicable to this one right here. So now that you're able to see some of the different scenarios to where inferior alveolar nerve would be, that's far away, and then even that is pretty close up. These are certain things I want you to be aware of. So all right, so once you get the tooth, so like I talked about before, we talked about flaps, we talked about sectioning. We also are going to be talking about how to prevent lingual inferior alveolar nerve damage, right? So when you are going to be operating, you want to take consideration that you're not putting too much pressure on the actual tooth, because when you're putting apical pressure on the actual tooth, the apical pressure is going to end up putting pressure on the inferior nerve, and there's an issue. Typically, in all the cases I've done, I would say the reason why there's been a challenge has not necessarily been because I've severed the nerve or cut it. It's been more so that you're putting so much pressure on it when you're working that it ends up causing that pressure to be responsive to the nerve, and when it's responsive to the nerve, it ends up shooting out signals, allowing the body to know, hey, there's been an insult. And when that anesthesia wears off, it's like, oh man, there's been an insult there. So those are certain things that you definitely want to take in consideration. So when you're sectioning tooth, I went over that. When you're about to section the tooth and actually remove it, you just want to make sure that you're not putting too much apical pressure. I went over the type of elevators that you're going to have when you're using them. And so the main thing is don't put too much apical pressure. You don't have to have big muscles to take out teeth. I promise you, it's all about your technique, right? So that's something that I really want you to take into consideration. All you're going to be doing is elevating from the mesial or the distal. You're not going to be pressing down into the alveolar housing when you're going to be removing those teeth. And I showed you on the last slide how to go ahead and take out those teeth. So here's a case right here. You could see that the inferior nerve is coursing right through this third molar right here. And typically the inferior nerve is going to be lingual too, right? It's always going to be, generally going to be lingual too. So anytime you have a question, get a CT scan and pull it up so you can actually see what's going on, right? And as this loads up, you'll be able to see. So we already flapped it. We're about to section. And this is what I want to show you after we start. So here I go. I'm starting to section this tooth, right? Most of the time it takes me is just more so just getting my self in proper positioning. So I'm going and starting section the tooth. So as you can see here, I'm starting to loosen this tooth up. And so I don't like the term troughing, because individuals typically are wanting to remove way too much bone, right? So when you're taking care of these teeth, let me just, I'm going to shoot back to this, but when you're taking care of these teeth, the main thing is not to provide any apical pressure. But I had a patient that I was working on. She was 35-year-old female, and she came in and she wanted to get her wisdom teeth out. Long story short, I told her, I was like, hey, you're going to have a paresthesia. Like, there's no ifs, ands, or buts about it. And at the time, I was not doing coronectomies. I just felt that it just didn't make any sense. But after doing a lot of research and study, I definitely am a proponent of doing coronectomies. But anyways, her roots were here, and her nerve was like this. And so when I was working on the tooth, I don't think I severed the nerve, because I'll tell you in a second. I didn't think I severed the nerve. But what I did do is I more than likely put so much apical pressure on these teeth. And I'm gonna show you in this video how not to put apical pressure, because when you're putting the elevator in the embrasure and you're twisting, that's the type of motion that you want to do. So when you push towards the tooth, you are luxating it. When you're going away from the tooth, you are elevating it, right? So when you put that elevator in, let's just say we got the mesial tooth over here and we got the distal over here, and we're taking out this one right here. If I put my elevator on it and I go towards it, that's going to be luxating, right? When I turn it upwards, that's elevating. And so I really want you guys to keep that in mind when you're working on these teeth. And so those are the two components that I want you to be doing. I don't want you pressing down into the site and just pushing pressure on it. That's not what you want to do. You want to either luxate or elevate, right? And so this is what I'm going to show you. So so if you look here, so it's already sectioned, right? And so as you can see, I'm separating the actual root as we're speaking. So I'm elevating out. So that distal part of that crown cracked off. So I'm going to go ahead and take it out. And so now I'm elevating that root. And so that's how you are going to not have any type of paresthesia, because what I'm doing is let me just back up. Make sure this is real clear, because this is super important. As you can see, when I was elevating, I wasn't putting a lot of pressure. You didn't see my hand doing one of these, like shaking. Doing one of these. That's not what you want. When you're elevating, what you're going to be doing is you should literally have the tooth to where it slides on out. And so as you can see on here, I removed I got a pathodraw for this actual tooth once I went around the buckle, and then once I sectioned it to create 2 individual pieces, and then I went ahead and elevated. And so as you can see, there aren't too much like really forcing the way to get this tooth out. It's just more so like elevating. And so that's something that I want you to write down in your notes, in your binder, Kim, and all those that are watching, because when you're doing cases like these, you want to make sure that you are not putting too much pressure, because if you put too much pressure, you could cause a jaw fracture. You could end up just cracking this crown off, and then it's just like all hell breaks loose. And so you don't want to have those. So anytime you're working, you want to have nice pressure. If your muscles are hurting as you're working, you are probably doing it all wrong. But that's what you definitely want to do. And so I'm gonna come back to this so that you can see it. All right, I want to take y'all behind the scenes. All right, here we are. So I'm gonna bring this back a little bit more. So that's when I broke off that distal portion, and you can see how loose that is. All right, that is super loose. Even when I pushed it more mesial, pushing it towards the distal, elevating it towards the distal, and I could just roll that tooth on out. And so right there, hold on, let me come back to this. So as you can see right there, I'm actually looking to see, I'm expecting those roots to see if there was any nerve tissue that was connected to it, right? And those are certain things, those are certain tips, those are like high level tips that you probably won't get anywhere, simply because the level of attention that you have to have when you're doing these cases is pretty high, but I want to make it simple. So for instance, typically speaking, if the roots are like this, sometimes you won't be able to see it, right? So if they look like this, they look conical, but in actuality, when you take them out, they have a distal, they have a palatal, they have a lingual bend, and they have a buccal bend. And sometimes they're like this and you won't see it. And so by me inspecting these roots, I'm seeing to see like, hey, as I remove them, is there going to be any type of hooks or delacerations that would impinge me taking out the tooth? And as you can see, when I was taking out that tooth, it was very, very easy to come out. And that's a good indicator of being able to determine, hey, do I want to leave this root or do I want to take it out? All right. And so in this particular situation, it was completely, I just took everything out because it came out in one piece. Right. And so those are different things on how you prevent infraocular nerve damage. Everything's clear, and I go ahead and I inspect that actual socket, and actually got my mirror to go in there and determine what, if anything, was present, just so I could actually see the infraocular nerve. Most times on x-rays of the one that I showed you, you probably won't see the infraocular nerve, just because there's a casing of bone just lingual to the root, and so it'd be the roots, bone, and then the infraocular nerve. And sometimes you actually see it. I've seen it quite a few times. It's basically looks like a kind of like spaghetti, like a yellow, like a beige tan spaghetti, and you could tap it and the patient will know, even if they're numb, they could still feel that, because that pressure is still present. And so one more time, to prevent infraocular nerve damage, you want to make sure that you are, number one, doing a section, nice path to draw. Make sure you're not putting apical pressure to compress that nerve. Also, make sure that you're going to ensure that when you section the tooth, you're not going to put too much force on it. Putting too much force on it can compress that nerve. Also, when you're taking out the tooth, is it easy path to draw? Because if the roots are dilacerated and let's just say the nerve is around it and it's not coming, don't try to force it out, because then you're going to cause a paresthesia. Also, DM me if you want to submit a question or a case, and we could discuss it on one Monday. We could talk about it this way that you guys could literally smile after surgery. The reason why I created this channel is so that you guys can do just that and just smile. Like I said, when I was doing my procedures, I didn't have anybody that was right there that could have access to. And I wanted to ensure that you guys have the necessary techniques. Also, if y'all wanted to get a little bit more, like I said, I have courses. You could go into my bio. Yeah, go in my bio. You could take the course and see how you could take your skills next level to specifically go into how I approach each case. Looks like we're good. I got a meeting. Guys, it's been an honor and a privilege to serve you guys again. Like I said, next week we're going to talk about nerve mapping and just give you a logical progression on how we go moving forward so that you can smile after surgery, guys. So remember, I'm looking at you. I'm looking at you. Remember, what looks hard is often easy. Make it a great one.